Black women are 3 times more likely to die from pregnancy than white women. Margot Snipe of Capital B News has long covered Black maternal health and pregnancy and joins me now during Black Maternal Health Week to discuss some of her reporting. Margot, thank you so much for joining me.
Thank you, Nicole, for having me.
As I just mentioned, Black women are more likely to endure pregnancy and postpartum deaths than their white and Hispanic peers. Based on your reporting, why is that?
There's a lot of different factors that makes it really hard to sort of put accountability to the racial disparities in maternal health outcomes. But one of the things that I really spent the past year digging into is access to care and access to quality care. Living in a maternity care desert, which is defined by the March of Dimes as having no OBGYN, no labor and delivery unit, and no birth center, that really impacts health outcomes. So when you look at the health outcomes for moms and babies, they tend to be worse in these counties that have less access to care. So in Georgia, we know that Black folks are actually more likely to live in these maternity care deserts.
So, from your reporting in Georgia, you also talk about how systemic racism has led to some of these lack of healthcare areas, and that in turn leads to more trauma for Black families. Was there anything else in that vein that you found during your reporting in Georgia?
Yeah, we did a few different data requests and combining data sets to just look at trends over time. So, what does investment in different communities look like over time? We found that twice the number of labor and delivery units had opened in white rural counties compared to Black rural counties since 1994. And at the same rate, Black counties were being disinvested in. So they were losing labor and delivery units at a higher rate over time. So it sort of shows this pattern in who's getting access to care, who's being invested in and disinvested in over time, which is also bleeding into worse overall maternal and infant health outcomes.
You spoke with quite a few families, and specifically a woman who struggled with postpartum depression, which is far more prevalent in Black families and Black women. Can you tell me a little bit about the woman's story that you covered and why postpartum depression is so pervasive?
There were a handful of women and men I talked to who were suffering depression after labor and delivery. Some of it was connected to near-death experiences. I think we talk a lot about maternal deaths, but there's a large number of women and families who are grappling with the mental health toll of nearly dying in childbirth or having a traumatic experience. So it's really frequent, honestly, that families are kind of suffering in silence when they have a traumatic birth experience.
Some of the families you interviewed had healthy deliveries, but then had some complications post delivery. How did their healthcare providers handle that situation, and how could it be handled differently?
I was asking a lot of people, but I was asking these families who had gone through this system and felt traumatized by it, who's accountable for this? Who do you feel is like responsible for, your story, your life kind of falling through the cracks? And a lot of them mentioned the hospitals, the medical providers. I think just something as simple as providing information about what mental health looks like after pregnancy is something that moms and families told me would really, really be important. We know doulas are super effective at being an extra advocate for Black women, Black folks when they are going through the birthing experience. So that's one protective factor. Finding doctors who are willing to talk about these disparities is another protective factor. And making sure you sort of know the statistics and are armed with the information, I think is important.
What more could healthcare providers or even politicians or lawmakers do to get ahead of or prevent so many Black families from experiencing birth related trauma?
I think one of the biggest conversations has been around expanding Medicaid. I know I looked specifically at Georgia. They got theirs extended to 12 months postpartum. But to try to sort of catch these families and get them more health care for longer periods of time, I know a lot of public health experts and maternal care experts have talked to me about mothers having access to care before pregnancy, so that they can deal with some of the health issues that they might have, or that they can just learn more about what pregnancy might look like. So a lot of folks and advocates have talked to me about expanding Medicaid, expanding access to high quality care. And from the mothers and family I talked to who did have access to care, it sort of looks like having more conversations about mental health and the risks.
This kind of reporting also hits close to home. For you as a Black woman, how has this experience and covering this changed or informed your approach to your own healthcare?
I think part of it for me personally is finding doctors who I know are aware of health disparities and these issues. So those are the types of providers I choose to see. Um, I also am in therapy. So taking care of my own mental health has been really important and critical through the process. I know the reporting has been really hard at times. And so my therapist, actually, her best advice has been to counteract some of the negative and traumatizing stories with some positive, happy stories of Black families having healthy babies and healthy moms, and so I think that has impacted how I navigate my own care. It's finding doctors who are aware of these disparities, who I feel comfortable talking about these things with, and also trying to balance some positive stories as well.
Thank you so much, Margot, for your time. Margot Snipe of Capital B News.
Thank you.